I'm Mark Ruffalo, and I'm pleased to introduce PRiSM, a new diagnostic instrument that I've been developing with my colleague, Dr. Ronald Pies. PRiSM stands for Psychopathology Refracted into Seven Modalities. It's designed to offer clinicians a more coherent, parsimonious way of thinking about psychiatric diagnosis. PRiSM began with a simple observation. In everyday practice, psychiatry has become increasingly vulnerable to polydiagnosis. Many patients accumulate 5, 6, sometimes 10 different DSM diagnoses over the course of treatment. Some of these labels overlap considerably, some are clinically redundant, and others lack strong validity. The result is diagnostic inflation, conceptual confusion, and treatment plans that are harder, not easier to implement. What PRiSM aims to do is to cut through that noise. Rather than multiplying discrete diagnoses, PRiSM organizes psychopathology into 7 core modalities: mood, anxiety, psychosis, behavior, trauma, stress, cognitive neurodevelopmental, and personality. These modalities capture the major ways psychopathology manifests in clinical life. The clinician begins by identifying which modality is dominant in a given patient. From there, the clinician can specify additional contributing modalities while still maintaining a clear central diagnostic anchor. The goal is not to replace DSM diagnosis, but to complement it, to provide a framework that's both clinically intuitive and more consistent with the realities of frontline psychiatric and psychotherapeutic work. PRiSM encourages the clinician to ask, what is the primary pattern here? What is the dominant psychopathology driving this patient's distress and impairment? And how can we avoid the unnecessary proliferation of diagnoses that often obscures rather than clarifies clinical understanding? Our hope is that PRiSM will serve as a practical tool for psychiatrists, psychologists, and psychotherapists who want to retain diagnostic clarity while acknowledging the dimensional, often overlapping nature of mental disorders. It is designed to be usable in busy clinical settings, but also rigorous enough to support research and academic inquiry. Psychiatric Times is now hosting a call for papers to encourage clinical, empirical, and conceptual work on PRiSM. We invite clinicians, researchers, and trainees to put the instrument to use, to test it, critique it, refine it, and explore its applications. This is an opportunity to help shape a tool that we hope will advance both diagnosis and clinical care. Thank you, and we look forward to the conversations and research that PRiSM will inspire.